Welcome. This decision aid will help you make a decision about different goals of care and related treatments that you, the doctor, and the nursing home care team might talk about to create a care plan for someone with dementia.
This decision aid will take less than 20 minutes to review. You can use it to help you talk with the healthcare providers who take care of the person with dementia.
This decision aid is for you if you help decide about healthcare for a person who has memory problems and cannot decide on their own, and you are the person who most often talks with the doctor and the care plan team at the nursing home to work with them to set a plan of care.
When a person has severe memory problems, he or she needs someone close to them to be their surrogate, to speak for them with healthcare providers. You are that person. You might speak for them because you are the family member who is most involved in decisions about care. You may also be the person's legal guardian or their healthcare power of attorney.
What is covered in this decision aid? This decision aid will define dementia, describe goals of care, explain why it is important to choose goals of care, discuss who decides, address how goals of care affect treatment, and what to expect with each goal of care. The decision aid will also discuss how personal goals might play a role.
What is dementia? Dementia is a progressive brain disease that causes memory loss and trouble with other aspects of thinking and taking care of oneself. People with dementia usually get worse over time. Remembering familiar people or events becomes more difficult, and so does speaking or doing simple tasks.
Dementia has many causes. The most common ones are Alzheimer's disease and strokes. People who get dementia usually are older and may also have other health problems. What happens to people with dementia? Dementia can be treated, but it cannot be cured. Dementia weakens the body, not just the mind. People with dementia may live for years, but the symptoms of their illness get worse over time.
Advanced dementia is the stage of dementia that is later and more serious. It can cause confusion, trouble remembering people, places, and time, trouble moving, walking, or doing simple activities, trouble talking, emotional problems such as sadness and anxiety. Advanced dementia also weakens the body, and because of this weakening, it can make the person more likely to get other problems, such as eating problems, like difficulty swallowing or weight loss, infection in the urine or infections in the lungs, like pneumonia, fragile skin or skin sores which can become infected, and falls and injuries like bruises or broken bones.
So we've talked about dementia. But what do we mean by goals of care? Many years ago, a doctor who dedicated his life to treating very sick patients once said that the goal of medical care is to cure sometimes, to relieve often, and to comfort always. This saying reminds us that medical care tries to help patients with three major goals. First, curing disease and prolonging life. Second, supporting function by relieving the effects of disease. And third, improving comfort for every patient. Dementia is a difficult illness and one that cannot be cured. What you can do is talk with doctors about which of these medical goals is most important. Keeping the person with dementia alive as long as possible, supporting their function and slowing its decline, or improving comfort and quality of life.
These goals all sound good. So why are you being asked to choose the most important goal of care? First, some of the goals people may hope for may not be possible, even with the very best medical care. Second, people have different ideas about which medical goal matters most when they have a serious or incurable illness. Choosing the main goal helps doctors and nurses respect what that person most wants and needs, while avoiding treatments they do not want or need. Prolonging life, function, and comfort are all important, but choosing which is most important will help to decide the best care plan for the person with dementia. You might think about this choice like choosing a path that will lead to the best care for the person with dementia. Which path do you think leads the person toward a better quality of care and quality of life despite their illness?
Who decides about the main medical goal of care? You are the most important person, but you don't make this decision alone. You know the person who has dementia best, who he or she is as a person, what makes him or her happy or sad, or what he or she has said about medical choices. You add his or her voice to decisions about goals of care. The nursing home team knows the most about care for the person with dementia, including nursing care, help with nutrition, social support, activities, and day-to-day personal care. The doctor knows the most about the patient's disease, treatment choices, and what to expect in the future. So you, the nursing home team, and the doctor will decide together.
What if you and the healthcare team disagree? Keep talking. What we know about the person's own wishes should guide this choice about the main goal of care. Ask the doctor or nursing home team to explain why they recommend a goal. Try to explain your choice to them. In most cases, prolonging life will be considered the main goal of care until you and the doctor agree to focus on a different main goal. Until you reach a shared agreement about the main goal of care, it is good for you, the doctor, and the nursing home team to keep talking about your views. How does a goal of care affect treatment choices? Treatment should be tailored to match the person's main goal of care. You, the doctor, and the nursing home team will agree on a main goal of care. Then you and the nursing home team will create a plan of care and treatment choices that match this goal.
Common treatments to think about include life support machines or natural dying, assisted feeding by mouth or tube feeding, hospital or nursing home treatment for acute illness, and antibiotics or medication for comfort for infections. You may also consider how to support function, how to treat pain or other symptoms, how best to provide emotional and spiritual support, and whether to add hospice or hospice-like treatment from the nursing home staff.
If the main medical goal is prolonging life, what can you expect? If you all agree that the main medical goal of care is prolonging life, then doctors and nurses will plan to use treatments that have a reasonable chance to help the person live longer. Treatments will depend on the person's needs and wishes, but could include hospital admission for most new illnesses, IV medicines and fluids, antibiotics for all infections, life support with CPR and breathing machine use if the person is near death.
Here's one story of someone with prolonging life as the primary goal of medical care. Bertha Tyson was an older woman with advanced dementia whose family and care team chose the main goal of prolonging life. As Bertha's dementia progressed, she had swallowing problems and she lost weight. With help from staff and a change to soft foods, she swallowed more easily. She had pneumonia several times and went to the hospital for IV antibiotics each time. While the antibiotics cured the pneumonias, being in the hospital distressed her at times. Her family would stay overnight to calm her. Each pneumonia left her a bit weaker, and she ate less despite the nursing home team's efforts to support her. Her family asked about a feeding tube. The doctor did not think it would help with the goal of prolonging life or make her better in any other way, but agreed if the family felt strongly. Bertha got pneumonia again and was very sick. She went to intensive care. While there, she got some medication to help her breathing feel more comfortable. Doctors tried CPR and a breathing machine, but they were not able to stop her death. Keep in mind, Bertha Tyson's story is an example. If you and the healthcare team choose prolonging life as the main goal of care for the person with dementia, a care plan will be tailored for that person. If the main medical goal is supporting function, what can you expect? If you all agree that the main medical goal of care is supporting function, then doctors and nurses will plan to use treatments that have a reasonable chance to slow the person's decline in function, helping them to do as much as possible for him or herself. Treatments for supporting function depend on the person's needs and wishes, but could include hospital admission, IV or oral medicines for new illnesses like infections, tests in the hospital or nursing home, therapy or activities to encourage movement, strength, and independence, emotional and spiritual care based on what is helpful to the person, orders not to use life support machines or a feeding tube.
Here is one story of someone with supporting function as the primary goal of medical care. Harold McNeil was an older man with advanced dementia whose family and care team chose the main goal of supporting function. As Harold's dementia progressed, he had swallowing problems and he lost weight. With help from staff and a change to soft foods, he swallowed more easily. Despite careful help with eating and diet, he still lost weight and was prone to infections. When his doctor and nursing home team thought it would help, they would send him to the hospital to get tests and stronger antibiotics. Going to the hospital was distressing to Harold and had some risks. Sometimes when he was sick, his doctors felt Harold could be supported and get good treatment in his nursing home room. After going to the hospital, Harold also received physical therapy to try to regain strength. Harold got pneumonia and he received IV antibiotics and IV fluids in the nursing home. He also got medication to make his breathing feel comfortable. His pneumonia didn't get better, and when Harold's heart finally stopped, he had a natural dying experience with his family and familiar staff taking care of him. Keep in mind, Harold's story is an example. If you and the healthcare team choose supporting function as the main goal of care for the person with dementia, a care plan will be tailored for that person. If the main medical goal is improving comfort, what can you expect? If you all agree that the main medical goal of care is improving comfort, then doctors and nurses will plan to use treatments that have a reasonable chance to improve the person's comfort and quality of life. Treatments for improving comfort depend on the person's needs and wishes, but could include treating as much as possible in the nursing home, hospital admission only when necessary to improve comfort, encouraging medicines and fluids to be taken by mouth, emotional and spiritual care tailored to what is helpful to the person, orders not to use life support such as CPR or ventilator machines or a feeding tube, hospice services or similar care provided by the nursing home team, other approaches to comfort such as music, repositioning, massage, or activities.
Here is one story of someone who had comfort as the primary goal of medical care. Carrie Worthington was an older woman with advanced dementia whose family and care team chose the main goal of improving comfort. As Carrie's dementia progressed, she had swallowing problems and she lost weight. With help from staff and a change to soft foods, she swallowed more easily. Despite careful help with feeding, she still lost some weight. Carrie was prone to infections, and each one left her a bit weaker, despite the nursing home team's efforts to support her. When she got an infection, she was given antibiotics by mouth in her room in the nursing home. When her doctor judged she had months left to live, a nurse and a nursing aide from hospice began to visit Carrie in the nursing home. Carrie got pneumonia again, and her family decided against the use of more antibiotics because they believed this treatment was prolonging her dying process, and she would not want it. She was treated with oxygen and medicines to make her breathing feel comfortable. When Carrie's heart finally stopped, she had a natural dying experience with her family, the hospice nurse, and familiar staff tending to her needs. After Carrie's death, hospice offered support for her grieving family and for the nursing home staff who had cared for her. Keep in mind, Carrie's story is an example. If you and the healthcare team choose improving comfort as the main goal of care for the person with dementia, a care plan will be tailored for that person.
Besides medical goals, what other things are important to the person with dementia? How do you also think about personal goals for someone with dementia so that their care includes more than medical goals?
Personal goals are the things you know bring joy to the person with dementia now, or are things you believe are important to the person with dementia because they represent their lifelong values. Here are examples of personal goals to consider. Things that bring joy to the person with dementia could include an event or visit that is important to them, finding meaning in doing as much as they can for themselves, wanting to be with family more, or needing pleasure from favorite music, foods, activities, or time outdoors. Things that represent a person's lifelong values could include wishing to avoid severe pain, wanting to fight to the end, hoping to avoid stress on family, or needing spiritual sources of comfort. These are examples, but personal goals are just that, unique to the person with dementia.
So how can you begin to use goals of care to help with healthcare choices? First, you can think about how much time the person with dementia may have left to live, how they most want to spend that time, what is really most important to him or her. Considering goals of care and treatment decisions for someone else isn't easy. You should think about how you are feeling. It can be sad or hard to talk about care for a person with dementia. Think about whether you need to talk with someone else about goals of care. Some people want to talk with the doctor taking care of the person with dementia. You can ask the nursing home staff to help you have time to speak to the doctor. Some want to involve other family members, close friends, or a minister, rabbi, or other spiritual advisor.
How can you be the voice for the person with dementia? You can be the voice of the person by imagining what the person might say if he or she was able to make choices about health care. Remember, this choice is not about what you want for yourself, but what the person with dementia would say if he or she could tell us. Using this information, you, the doctor, and the nursing home team will work together to make a decision that is best for the person with dementia. Some people have told their family what is important to them if they faced a serious illness. Has the person with dementia ever talked about this or put wishes in writing in a living will document? Some people's religious values shape their goals of care. Does the person with dementia have strong religious values that shaped his or her thinking about medical treatments?
What happens next, now that you have learned more about dementia and goals of care? First, decide on the main medical goal of care and any personal goals that should be most important to guide care for the person with dementia. Second, Talk with a person's doctor, nurse, and other people providing care. You can talk to them by phone or in person. A good time to talk could also be at the next nursing home care plan meeting. Try to reach agreement on the main medical goal of care and specific treatments that should or should not be used based on this goal. Third, remember this information if you need to talk with doctors at the hospital or other places the person goes for health care.
Thank you for taking the time to consider goals of care and for being the voice of someone who has dementia and cannot speak for themselves.